So the American Heart Association announced some new guidelines for treating cholesterol in young adults. It's suggesting screening people in their 30s before risks of heart attack and stroke become higher. Seems like a good call. Our medical expert, Dr. Payal Kohli, is here to sort of tell us if that is a good call. I'm wondering what's your biggest takeaway as a cardiologist from the new cholesterol guidelines?
I mean, this has been a buzz all weekend. We've been talking about it, and we had it right before, but now we have it even better. So what we used to do before was wait for your heart attack or stroke and then react and then get your cholesterol down. Now we've realized it's something called cholesterol years of exposure. Your cholesterol being even slightly high, but for many years, your entire life basically leads to heart disease in your 40s, 50s, and 60s. So we start screening even earlier than 30. In fact, the first screen happens when a child is 9 years old.
Wow.
9 to 11, you screen them for high cholesterol, because what you don't want to do is get caught unawares because they get into their 20s and 30s and all those years that
Where does that happen? Do you have to do a special test, or is that done
at
at
the pediatrician's office.
Do you have to ask for it, or is it done with other
so
things?
now the guidelines have put it in there. Now by the time it makes it into the pediatrician, it might take some time. So I would say if you're a parent of a child, ask your pediatrician, is it time to screen my child for cholesterol? If you're an adult who's never had a cholesterol done, then for sure you need to get screened, because lower is better for longer when it comes to bad cholesterol.
Amen.
That's the mantra they've made.
I like
Lower
that.
is better for longer.
Right. So even then, teenagers, young people in their 20s, everybody should say, hey, I want to know right now.
For sure. And so the spacing, the screening interval might be spaced out when you're a teenager. If you check it once, it's not bad. You don't have a genetic condition raising your cholesterol. I might not look again until you're an adult or for 5 years later. But that's how we find people who have genetic causes of high cholesterol, because 75% or so of our cholesterol is genetic.
That's what I was going to say. It seems like you hear if mom, dad have high cholesterol, then oftentimes it's passed on.
Yep, but sometimes you can even get a spontaneous mutation. So even if you don't have a family history of high cholesterol, your DNA can make a copy when it's replicating, and you can have a bad cholesterol gene.
I think when it comes to anything, and as a doctor you would know this, people can be hesitant.
Yes.
They hear a word like statin.
Yes.
And like, oh no, I can't be on statins, that's for older people or whatever. But do the guidelines now change when people should start thinking about statins as well?
So they're saying if you're over the age of 30, so I'm starting my 30-year-olds on statins now. Yes, which is a total paradigm shift. And their bad cholesterol is greater than 160. That's the LDL. It's time for a statin. Now, ideal cardiovascular health means your LDL, bad cholesterol, should be less than 100. So if you're that 100 to 160 period, sometime between 30 and 40, I'm probably going to start you on a statin. But the idea here has become to use a more sensitive risk calculator, that's also in the guidelines, and to change the classification of what's considered high risk. Because statistically, guys, what's the most likely thing that's going to happen to us?
Probably a heart attack or
disease, right?
Yeah.
#1 killer of men and women in the US and worldwide. And yet we just make up the risk, or we wait for it to manifest and then treat. So the idea here is to get ahead of the disease, be smarter than it, and start looking for it before it starts to manifest itself.
So I always think about sometimes, like when you hear about these things, people say, well, I'm better not knowing. How do you turn that around?
You know.
Like a lot of people don't want to know things. Like it's like too much information.
So bad cholesterol will increase your risk for heart attack, stroke, and dementia. And so not knowing and getting caught unawares is sticking your head in the sand. Instead, know that 80% of heart attacks and strokes are preventable, and cholesterol, again, is one of the most modifiable things. So you check it, you treat it, and to your point, Phil, statins aren't a marker of disease, they're a marker of health. They help you age better. They help your blood vessels. They protect your blood vessels from getting cholesterol deposits. So I actually think of it as an empowerment that you're taking control.
Sounds like the way people think about vitamins and supplements and things like that.
Right.
But so for people who don't really know, what is a statin? What does it do? And does it have any side effects?
Yeah, so statin is the most commonly used medication. It reduces the production of cholesterol in your liver and also helps clear it out of the bloodstream. And so it's very safe, very well tolerated. It's been around for several decades. In fact, there's even a push in preventive cardiology to make it over the counter, because people just psychologically are more likely to take something over the counter than a prescription.
Right, that's why I asked you to explain what it is, because I think people are hesitant.
I mean, I started myself on one, my mom's on one, my brother's on one, because it helps you age better. We know that they're going to get stuck, the cholesterol, and so reducing it is really important. So make sure that LDL, bad cholesterol, is double digits. Also, when you go to the doctor, these guidelines have added 2 more tests for you to get. One is called a ApoB, and one is called a lipoprotein A. These are blood tests. And if you're over the age of 40, think about an X-ray of the heart called a calcium score.
So you should push for this, right? Because sometimes when they'll say, let's do a blood draw. You don't even think what they're testing
You
for.
have to ask Kim. And I cannot emphasize that enough because a lot of primary cares, number one, don't know these new guidelines. And number two, it's a preventive test. And so they're so busy putting out fires that they're doing the same preventive tests we did 20, 30, 40 years ago. And now we're really pushing to say lipoprotein A, ApoB, calcium score, which is an X-ray if you're over the age of 40, and measure your numbers early, treat them early, and just take control.
Yeah, you got to be your own best advocate sometimes.
For sure.
All right. Dr. Kohli, thanks so much.